Hello guys, so this is Oscar with Owi. Today we are going to administer oxygen. Okay, this is part of one of the scenario or one of the practical session you need to do during the OSCE for adult nurses. So I'm going to read a scenario. Okay, that's what we are going to use to administer the oxygen. So Jenny Smith admitted to AMU with shortness of breath and diagnosed with pneumonia. She has pain, that is pain score of 4/10 at the back of chest and coughing. News that's respiratory rate is 28 beats per minute, which is high. Oxygen saturation is 89% on room air, which is very low. Pulse rate is 94, a bit high. BP is 96/62. And temperature is 37.8. So what are you supposed to do? You are supposed to provide oxygen therapy and complete the relevant documentation. So you need to sign, write the date, and the flow rate and the device. So what are you supposed to do? You talk to the patient or the person, you verbalize what you are doing and why to the examiner. Okay, then you read out the chart and explain what you are checking, giving, not giving, and why. You need to complete all required drug administration check, complete the documentation and use the correct code. Okay, then complete every documentation you're supposed to. So this is a 10-minute station. Okay, and the date is today, the time is 10:00, that's 10 a.m. Okay, so I'm going to start the procedure. Yeah. Okay, so the procedure is about to start. So I enter the scene, check the environment that is safe for my patients and myself. I provide privacy and dignity by pulling the curtains. I perform hand hygiene, palm to palm, back of the palm, fingers interlace, fingers interlock, fingertip rotating, tongue rotating, wrist rotating, wrist rotating. I do this for 30 seconds, allow you to die for 30 seconds, assume my 30 seconds has passed and I'm happy to approach my patient. Okay. So hello, I'm Winifred, one of the nurses taking care of you today. How would you like me to call you? Jenny Smith. Okay, so Jenny Smith, before we continue, I'd like to confirm your ID, okay? Identity that you're the right patient. Could you please confirm your date of birth and your full name for me, please? Jenny Smith, date of birth 1/1/1943. So Jenny Smith, I'm going to do that against the wristband, okay? That will be on the patient's wrist. Okay, so Jenny Smith, date of birth 1/1/43 to 1/1/43, that's correct. Your hospital number is 004382 004382. Okay, so I can confirm you are the right patient. Do you have any allergies? No. Okay, so since you have no allergy, as I said earlier, I'm here to administer your prescribed oxygen as directed by doctor today, okay, at 10:00. The reason why I'm going to give you this oxygen is because you had a saturation rate of 89%, which is low. Okay, so you've not reached the target saturation level of 94 to 98%. Okay, so this oxygen is going to help you breathe and to manage your saturation level. Are you happy for me to do it? Are you happy for me to do it, please? Okay. So Jenny Smith, I'm going to prepare the equipment for the procedure. So in case you need me, I'm just close by. Kindly you call my name. Is that okay? Alright, so I leave the patient perform hand hygiene. Okay, so examiner, I can confirm. So I have my tray here. My tray and trolley is clean and ready to be used. Okay, so I have my equipment here. I have my reservoir mask here, which is clean. It's supposed to be in a pack. Okay, it's going to come in a pack. This I've already opened it because I use it to teach a student, one of my students. So it's supposed to be in a pack. Alright, so examiner, I can confirm that the reservoir mask is clean, intact. Okay, and not broken. And if it's open like that, you need to ask the examiner, please, is it in date? If it's in the pack, there will be an expiry date on it, so you need to confirm from there. Alright, so examiner, can you confirm whether it's in date? Okay, it's in date. Alright, so this is a hospital medication record. Okay, for my patient Jenny Smith, date of birth 1/1/1943, hospital number is 004382. Patient has no known drug allergy. Prescriber's signature bleep number is present. Date is today. So my patient is not a known CO2 retainer. Okay, so at that prescriber, they will have a session where you need to take the yes or no. So if it's no, that means the patient is not a known CO2 retainer. But if it's take the yes, that means the patient is a known CO2 retainer. So you need to read all that is on this sheet. Okay, alright. So when required oxygen therapy, target oxygen saturation 94 to 98%. Starting device is reservoir max. Flow rate is 15 liters per minute. Start date is today. Time is 10:00. Prescriber signature bleep number present. Pharmacy check. Stop date is PRN. Okay, so I can confirm that this is a valid prescription, so I'm happy to use it. Okay, so I approach my patient, perform hand hygiene. Okay, so Jenny, I'm about to start the procedure, but before we do that, can we do a second ID check? Is that okay by you? Alright, so can you please confirm your date of birth as I check against your wristband? Janie Smith. Date of birth 1141, but that's correct. Passport number is 004382. So I can confirm you have no allergy. There's not I can confirm that this is a valid prescription, so I'm happy to proceed. Perform my hand hygiene again. So Jenny, I'm about to start the procedure. Are you happy for me to do it? Okay, so I pick my mark. So I'm going to use this as my patient, alright? Okay, so in the rubber, if it comes, it will be apart during the exams, okay? So examiner, I'm going to assemble my reservoir marks to the tubing. So the tubing has two ends. One will be for the flow meter, and one will be the one you attach it to the reservoir marks. So I'm going to assemble and attach one of the tubings to the reservoir marks and connect this to the flow meter, okay? So I'm going to adjust the flow meter to 15 liters per minute so that the ball will be in the middle of the line. Then I'm going to cover my finger, okay? I'm going to use my finger to cover the one-way valve. So this is a one-way valve inside here. You press it. I'm going to press it so the bag is fully inflated. This bag is fully inflated. So I'll press it so the bag is fully inflated. Okay, so Jenny, I'm going to attach this to your nose and mouth and put this strap at the back of your head. Okay, I'm also going to adjust the nose brace and pull the strap so you become comfortable. Is that okay? Alright, so I'm going to put. So this is how you go by it. Then you put this at the back of the head. I don't have a patient, so I'm using this. Please, you're not going to tie it, okay? Because it's not a human, it's just a touch. So you put this at the back of the head, okay? Then you attach this to between the nose and the mouth, okay? Then you are going to adjust the nose braces. That is here. You adjust the nose brace, okay? You adjust the nose brace. You can press on it. Then you pull the strap. There's this elastic strap here. You pull it. Then you ask the patient, Jenny, is it too tight? Are you comfortable? Okay. Since you're comfortable, then I think that's okay. Alright, so Jenny, I'm finally done with the procedure. I'm going to give you a bit of education. So what I'm going to do is I'm going to reassess your saturation so you could reach a target of 94 to 98%. In case you're not able to reach that target, I'm going to escalate it to the doctor. I'm also going to check, because of the strap and then marks on your face and nose, I'm going to check around your face, the back of your head and your ears for any bruises or injuries or any marks. Okay, I'm also going to provide regular oral mouth care. Is that okay by you? Alright, so JD, I'm going to take my leave. In case you need anything, just kindly use the call bell. Is that okay? Alright, so I'm going to, as I'm now, perform my hand hygiene and do my documentation. So the documentation, I'm going to write my name up there, write the date, which is today, 25th June. Time is 10:00. Flow rate is 15 liters per minute. Then the device is reservoir max. Make sure you've done everything. Pharmacy check, everything is there. For example, I'll discard my used items. So the used items to the clinical waste. I can confirm that my tray and trolley is clean and ready for the next use. Perform my last hand hygiene. Place I finger interlock, finger to rotating, finger to thumb rotating, wrist rotating. I do it for 30 seconds. I like to do that for 30 seconds, and I would like to end my station. Thank you very much. Bye.